with orthopedic surgeon Dr. Kenneth Hunt from CU Medicine, Orthopedics, and Sports Medicine at the Steadman Hawking Clinic in Denver, Colorado. Today we're talking about minimally invasive treatments of the foot and ankle, which is allowing both athletes and weekend warriors alike, like myself, get back to the activities they love. More about minimally invasive treatments in a moment, but first, Dr. Hunt, please share your background with our audience.
I'm Ken Hunt. I'm Associate Professor in the Department of Orthopedics. I am the Chief of Foot and Ankle in the Department of Orthopedics, and I'm the Director of the Foot and Ankle Center, the UC Health Foot and Ankle Center in Central Park. I also work at the Steadman Hawkins Clinic, Denver at Invasive.
Dr. Hunt, what types of minimally invasive surgical techniques do you use specifically for treating athletic injuries to the foot and ankle?
Great question. So minimally invasive techniques have really evolved, especially in the last 5 years. I would categorize minimally invasive techniques as arthroscopic or endoscopic, which is using a small camera to reach joints or difficult to see spaces, and percutaneous procedures, which means we perform procedures through very small incisions.
How have minimally invasive procedures you offer aided some of the professional athletes and sports teams you work closely with in getting back on the field quickly?
I do a lot of minimally invasive procedures, but I'm going to name 3 that I think I do very commonly and that have resulted in a noticeable improvement in outcomes, meaning a more rapid return to sport, a lower chance of re-injury, and an easier recovery, a faster return to recovery. One of them is a minimally invasive Achilles tendon repair. It used to be a 6 to 10 centimeter incision in order to access the tendon to see the ends and be repaired. And now it's a 2 centimeter incision, much, much smaller. And the technique allows us to repair the tendon together without all that tissue dissection. And again, it's not just the skin incision, which is what you see, it's all that fibrosis and stiff tissue that occurs and the scarring of the tendons and extrahepatic tissue. So all that gets mitigated and we can get them moving earlier and there's less pain and there's less swelling. And we found that return is faster. And so what used to be, for example, in a football player, a 12-month injury, we're typically getting them playing in 6 to 7 months. The second one is a procedure that I do frequently, and that is arthroscopy of the big toe joint. It's very common in athletes to develop spurs in their big toe joint, to develop small cartilage defects, and problems with the sesamoid bones, problems with the ligaments, what we call a turf toe injury. So in order to access those, it used to be a relatively large incision. We would have to use big instruments like saws and mallets and chisels in order to remove these bone spurs. And that always created a lot of scar and a lot of bleeding and a lot of stiffness. And so we would tell these athletes that we can take the spur away, but you're going to lose some motion because of the tissue dissection. But that's no longer the case. Now I can do that arthroscopically. So I use a little camera to a 3 millimeter incision. So I'm not dissecting all that tissue, the capsule, the periosteum, whatever they call it. And I'm able to see the entire joint and use smaller tools to remove the spur, to remove any loose fragments, to address the cartilage. And the key advantage is that instead of waiting a week or 2 weeks to let these toes move, because I worry about having a wound problem, now I let them move immediately. The third one, and I think the one I may take the most pride in, is a less invasive approach to Achilles tendonitis. So this is typically in the running athletes where there's pain in the back of the heel where the Achilles tendon inserts on the calcaneus bone. And it's very common in runners to develop inflammation around that tendon, or more specifically, inflammation between the bone and the tendon. And so what I've developed is an arthroscopic technique where I can access that space, remove all that inflamed bursa, clean up the tendon, meaning remove the inflamed parts of the tendon, and remove the spur. And so that mitigates both the causative factor, which is the bone spur, and the bursitis, and the result, which is the inflamed tendon.
For weekend warriors like myself, who suffer frequently from sprains and chronic issues like Achilles tendonitis, how could these minimally invasive surgeries benefit them in managing and overcoming their injuries long term?
A great question. For what it's worth, that's still the majority of what I treat. Right? Like I manage professional, collegiate, and other Olympic level athletes. But most of my patients are weekend warriors who have passion for their sport, and it's a really important part of their lifestyle. We live in Colorado, where where the majority of people want to be active. That's why you live in this area. So I think the most accurate way to answer the question is essentially a more rapid recovery with less pain, right? Really take a lot of pride and have a lot of joy in seeing all patients get back to their preferred activities.